15 minutes long. You hit start? Okay, you can hit start. My name is Rowland, and I am a massage therapist, and I was trained in manual therapy techniques or neuromuscular therapy, and I'm the owner of Raymond Clinic, and I'm also a continuing education provider for massage therapy. And I just want to thank you guys for coming out here today and supporting me. Today we're going to be talking about manual therapy and how manual therapy facilitates healing in our bodies. Right? So one of the things is I just want to take you with me to think about, just imagine you sitting in your car and you can't turn on the radio. For some reason, your arm is stuck. You can't move the shoulder, you have no range of motion in the shoulder. And it's beginning to get very, very painful and it's stressing you out. So, you go to the doctor and the doctor says that he's going to do some tests on you. So he runs some tests on you and he did an MRI, an X-ray on you, and he figures out that you are suffering from frozen shoulder. So frozen shoulder basically is an umbrella term for a whole host of other things that could be happening within the shoulder joint itself. So after your visit, he prescribed manual therapy. So you came to see me. And now I am going to talk about what is frozen shoulder first. We'll talk about what is frozen shoulder. Frozen shoulder is basically when the joint in someone's shoulder is stuck. Or another name for it is adhesive capsulitis. Or tendonitis in the shoulder, which is inflammation in the tendons, the structures that connect the muscles to the bone. Or he would say you have bursitis, which is inflammation in the bursa sac. So the bursa is that structure in your joints that when you move the joint, it provides a fluid that lubricates the joint, so you have that fluid movement. When that gets inflamed, it's called bursitis. And when people have bursitis, their joints get stuck. You can't move it until the inflammation goes away completely. Right? So this is where manual therapy comes in. So we talk about Whitney Lowe said women are affected more than men with this condition. And it is postulated that because of the changes that women go through as they experience menopause, it affects the tissues in such a way that makes them more susceptible to this type of condition. But in general, people between the age of 40 to 70 experience this. And it lasts for about 18 to 24 months or more or longer. This condition, frozen shoulder. It comes in three parts. First, you have like a condition where you get symptoms where it starts to get, or signs that it starts to get tight. You wonder what's happening. Your shoulder starts to get tight, or usually the shoulder starts to get tight. Eventually, it just hits you and it gets frozen. After the frozen part of it, months or years down the line, the shoulder starts to thaw out, where you have, on its own, without doing any therapy, it becomes more movable. After that, it becomes freely movable. And down the line, you can still suffer from frozen shoulder. But this is the case with frozen shoulder. The next thing is, what is manual therapy? Manual therapy basically is hands-on techniques that it utilizes these hands-on techniques that alleviates pain and improves mobility in the joints and in tissues. So the therapist actually uses different techniques to make up manual therapy. Heat, ice, lymphatic drainage, neuromuscular therapy, stretching, and soft tissue manipulation. All these things is an integrated system that makes up manual therapy, right? So the next thing is Donna, the author of the book, The Balanced Body, says a person who practices this integrated type of tissue therapy could be considered an educator. Why? Why is this person considered an educator? Because through manipulation and realignment of the body's soft tissue, the therapist teaches the client how to relax, how to stay balanced, and how to stay pain-free. So this is how the therapist is considered an educator. I want to introduce my daughter, Sarah, here. Sarah was diagnosed with a subluxation in her elbow. She fell. She's a dancer, professional dancer. And Sarah fell and hurt her elbow. Her elbow actually was subluxated. She went to we rushed her to the ER, but on the way, before she got to the ER, she popped the joint back in position. Very, very painful situation. The doctor did his test, and when he did his test, he did x-rays and MRIs and neuromuscular tests and all that, and he came up with the fact that she has a subluxation, where the elbow was completely slipped out of the joint. And because that happened, it was extremely painful, and her arm was stuck in this position for a while. She couldn't move her arm. It was extremely painful. So they put a cast on it so it wouldn't create any further damage to the arm. Sarah's healing, a little bit about her healing. The doctor prescribed manual therapy and medication and all that, but we didn't really want to give her too much medication. She's only 16. So I took up the responsibility to do the manual therapy on her arm. This lasted 3 months. The first 2 months of me treating her, I did petrosage, effleurage, and the use of ice, lymphatic drainage, friction, all these simple techniques I did on her. Now, petrosage is a manipulation of the tissue where we milk the metabolic waste out of the tissues. It's just about just kneading, just like how you knead bread. It's like a kneading technique we use. It's called petrosage. Effleurage is more of pushing the fluid away from the joint, away from the affected, the dysfunctional tissue. And lymphatic drainage is more of a lighter technique where we also use to move the lymph along in the body. And the ice I use to bring the inflammation down, because the joint was so stiff, she couldn't move it at all. And this was the first 2 months of her treatment with me. The beginning of the last month, I was able to incorporate stretching in the joint. I was able to incorporate stretching. So because I was able to incorporate stretching, that allowed me to be able to elongate the tissue. And it took a while. And this is every day we had to do this. And at that point, the swelling went down. The stuff that was inhibiting the joint from being flexible was sort of moving away, or the adhesions that was built up around the tissue so it wouldn't form scar tissue. I did friction around the joints and at the insertion or the attachment of the joint and the bones, I had to do circular friction with my thumb, like this, around the joint, constantly, to increase the flow of blood and nutrients to come to the area. And eventually, with a lot of ice, the swelling went down. And as the swelling went down, the joint was able to move a little more. But she didn't have full range of motion. First it was stuck like this. Maybe she had 45-degree range of motion, then 50, and then it came to 90 degrees after the end of 3 months. Sarah was lucky. There were no damage to the bones or anything like that. It was just a soft tissue injury that affected the bursa sac, the bursa, and the tendons in the joint. And I want to show you after that. This is Sarah and my son David as they were performing after this. Pay attention to her left arm. Incredible. Thanks to manual therapy, Sarah is now free from that restriction in her joint. She has full range of motion in all directions of her joint. So Gachi said the goal of manual therapy or myofascial pain therapy, is to desensitize the pain-causing trigger points to the extent that the physiologic loading no longer produces any symptoms in the joint. Those big words. Basically, what it's saying is that there is no adhesions, there's no fluid buildup in the joint, and there is no restrictions in the joint. Basically, this is what it's saying. The joint is not loaded anymore. Right? And why is manual therapy so effective? Manual therapy is effective because it controls pain, it improves tissue extensibility, it helps to be able to manage the stretching of the tissue, it improves range of motion greatly, it facilitates tissue repair, it mobilizes soft tissue and joints, and reduces restriction and reduces swelling and inflammation that happens in the bursa of the joints. So some of the indications for manual therapy is pain, lack of range of motion, and stiffness. Some of the contraindications or reasons why we shouldn't do manual therapy on someone is severe swelling, bleeding, any open wounds, any fever, any infections, if the person is too tender to the touch, and of course if they've had too much alcohol. We wouldn't do manual therapy in those cases. Some of the techniques used in manual therapy would be myofascial release, strain counter strain, those are specialized stretching techniques, and then we have trigger point release, and then we have cross fiber friction. Those are some of the main techniques that are used in manual therapy treatments. Whitney Lowe says, severe injuries in cases like this can be avoided if early signs of dysfunction is addressed. And we find the tissues that are dysfunctional, isolate those muscle groups, and are able to work on them right away, right? Those are some of the things that we need to look for as a manual therapy therapist. Type of treatment associated with manual therapy: stretching, heat, ice, lymphatic drainage, neuromuscular therapy, and myofascial release, as well as friction. Deep friction, superficial friction, circular friction, and cross-fiber friction. Those are the frictions that are used in these techniques. Who would benefit from this? Anyone who wants to maintain optimal tissue function, victims of trauma and soft tissue injuries. In summary, we've discussed frozen shoulder, what is manual therapy, why is it so effective, some of the indications, contraindications of it, some techniques used in manual therapy treatment, the types of treatments associated with manual therapy, and who would benefit from it. Also, in conclusion, when pain and stiffness plagues the body, your body, this integrated form of treatment is designed to restore normal tissue functions, and is the most natural solution for treatments without taking medication, manual therapy. I've had a client once said to me, my favorite childhood memory is when my back was never hurting me. And that concludes today.